Good afternoon. I'm Patricia Capella, Conference Manager for Clarion UX Food and Beverage Trade Shows, which produces several industry events and conferences, including the most recent International Restaurant and Food Service Show of New York, which was held at the Javits Center in New York City. Thank you for joining us today for our webinar. Given the current situation surrounding COVID-19, we thought it was important to offer insight on what you need to know and do now as the situation is rapidly changing. These preparations are very important during this pandemic to make sure the staff in the kitchen, as well as those interacting with customers, are safe for those in the restaurant and through pickup and delivery. Joining us today is Roslyn Stone, MPH, CEO of 0 Hour Health, founder of Zedic, and a public health and risk management thought leader specifically in the restaurant and food service space. She will provide and guide us with the latest on the COVID-19 outbreak. A few housekeeping notes before the presentation begins. All audience members are on listen-only mode, which means you are muted. We will be monitoring audience engagement on the dashboard and encourage you to participate by using the question pane. There will be time for questions and answers at the end of the session. This webinar, as well as others in our series, will be made available on our website in the coming week. Now, let me turn the program over to Roslyn. Roslyn?
Thank you very much, and good afternoon, everyone. The presentation that I'm about to give is one that I gave in an abbreviated format at the International Restaurant Show at Javits Center a week ago Sunday. And when I spoke with the folks at Clarion and we talked about doing this today, I said I'd like to wait until the last minute to edit it. And at 7 o'clock this morning, I edited it and was really struck by how much had changed in this situation from when I did this presentation 9 days ago until this morning. And I really found that a striking and slightly alarming thing. And then we passed the presentation back and forth this morning and ended up editing it, and the last version was at 12:50. The version that you're seeing was edited at 12:55 p.m. Eastern time today, and the situation has changed even since then. So I apologize when I get to certain slides that I'm going to correct things or provide addendums to things that are on the slides. Again, this is a situation that is changing so incredibly rapidly. I want to tell you a little bit about myself and what got me here to be doing this presentation today. We founded 0 Hour Health almost 30 years ago. The original business name was Corporate Wellness. We worked with corporations that didn't have their own medical departments. And in one of our very first clients was Outback Steakhouse. They had 40 restaurants. A few years later, they went to write their first crisis manual, and they came to us and said, we'd like to arrange with you for you to be available to use your medical resources and our resources when we have a variety of employee, patron, or community health issues, and that together we'll figure out what to do in those situations. Fast forward from that conversation, which was probably 25 plus years ago, till about 3 weeks ago when our team was on site at the Super Bowl and screened every food service worker that handled food that day. On a football Sunday, until COVID-19 came around, our clients fed about 10 million people across our client base, which includes all size companies. In the last 2 years, we've been working on launching a new business, which we named Zedic, which was how to help the smaller operators. The services that we've provided in the past were very much geared towards the large organizations and priced in that way. Some of our target market were people that had been speaking to us that had left those large organizations and were starting their own restaurants or their own small groups. And timing is everything and nothing, which is that we launched Zedic early in 2020. I'll show you how to see Zedic later on, but Zedic is an app that has all of the same tools and documents that we give our large corporate clients available through an app, and then you can chat with our team 24/7 to get more specific advice. What are the real health issues that the restaurant and lodging industry are facing today? I need to spend a moment talking about how today differs from last year, because we are really obviously in a very different place. But last year, the #1 health issue that we dealt with restaurant clients was hepatitis A. The hepatitis A outbreak, which started a little more than 2 years ago and started in Houston and then in San Diego, really dramatically impacted this industry and how we think about employee health issues in this industry. Where there were a couple thousand cases of hepatitis A in the entire United States, maybe 3 years ago, there were 31,000 in this outbreak through the end of 2019. And for those of you who've been through a Hep A, you know the pain. For those of you who are on this call that are in Florida, you know what you've seen in the news if you haven't experienced it yourself. But if a restaurant has a single food service worker with a case of hepatitis A, even when there's no transmission of illness in the restaurant, and we never have a reason to expect that there will be, the health department will likely, particularly in Florida, go public. And when they go public, a restaurant loses up to 70% of its revenue. They may claw back and they'll be down at 70% of lost revenue for upwards of 6 weeks or longer. A year later, they may not be back to their pre-incident revenue. I'm talking about all of these, and I want to focus on these other illnesses for just a couple minutes, because these things that we've experienced together in the last year and 2 and 3 years are things that leave us incredibly well prepared for facing COVID-19, for preventing the transmission of COVID-19, and for ensuring that we're not part of the growing problem of its transmission when we can help it. So the number one issue that we dealt with in 2019 for our clients was hepatitis A. In a normal year, it's norovirus. In a typical year, 58% of the calls that we get from our clients are related to noro-like illness, nausea, vomiting, and diarrhea. Very similar to coronavirus in many, many ways. The good news about coronavirus is that it is a lot easier to kill than norovirus. For any of you who've ever had norovirus yourselves or had norovirus in your homes or in a restaurant, you know it's hard to get rid of. You've got to get sick employees out for 3 days, 2 to 3 days. You've got to bleach every surface in the restaurant. Coronavirus is much easier to kill by virtually any household cleaner or any EPA-approved cleaner, and we'll get to that in a minute. Last year, we had our first experiences with restaurants and with our employee populations and measles. And I bring that up because measles gave us some really important lessons for how to deal with health departments and the issues that we face when we're getting a new illness and health departments are dealing with it for the first time. So when we had our first case of measles in the restaurant community, it was in Ann Arbor, Michigan, and it was a health department that had never seen a measles case before in a restaurant or really in their community. They were no different. Our whole medical team has never actually seen a single case of measles in real life. So there were some really important lessons learned there. The first few days, the health department was very low key, and they published a report about what restaurants this, it was an employee, but what restaurants this employee or these places this employee visited during the period that they were infectious. And then, you know, we were chugging along. Restaurant business really wasn't affected. You know, people were being cautious. They were washing their hands. And then on day 4, the health department decided that they were going to exclude everyone who hadn't yet been able to provide proof that they'd been vaccinated. Well, that shouldn't have been that big of an issue, or at least at that point, we didn't know how big of an issue that was. So this particular restaurant had a very large staff. They had about 220 employees. 180 of them are in the front of the house and 40 of them are in the back of the house. So guess which part of the employee population wasn't able to produce their vaccination records? It was those that were in the back of the house. And it is really hard to run any restaurant without the back of the house. So our takeaway from there was to get more proactive on the first day when we hear about any virus, whether it's norovirus or measles or coronavirus, and not be complacent in doing everything we can to make sure that we've excluded anybody who's sick, that we've gotten records that we need to get, that no matter how relaxed the health department may seem about it, that we need to be proactive in the steps that we take. When I give this talk elsewhere, I spend a little bit more time talking about homelessness, but hepatitis A and the opioid problem are inextricably intertwined, and a lot of our clients have dealt with issues related to homelessness as it impacts the restaurant community in the last year, particularly with regard to bathrooms. And I'm talking about that now because the cleanliness of your bathrooms are particularly important when it comes to preventing the transmission of coronavirus. We find that keeping bathrooms clean and in communities where there's high homeless populations, where we're finding needles in bathrooms, drugs in bathrooms, sick people in bathrooms, is challenging, and certainly more challenging when it comes to dealing with issues related to coronavirus. So this is just a picture of what we deal with in a year. Gives you just to give you a snapshot of who we are in our experience. And now I will move on to talking about coronavirus. What does the COVID-19 situation look like today? Again, wrote this early this morning, and it's changed since then. So we've had a huge jump in the US case count yesterday and today. And the huge jump is in large part because more people are being tested, but also because we're now somewhat changing the case definition. And that when someone presents to their doctor with the symptoms, whether or not there's testing available, we're presuming that they're positive. The New York City Health Department and the CDC, and we get a lot of information from both of them, are now basically using a different set of terms, literally in the last 24 hours. They're talking about widespread community outbreak. So we're no longer really looking at containing this in the same ways. We're looking at how to get through this and get to the other side of this epicurve without, with using the resources that we have and ensuring that we've done everything that we can to get care to the people who need it and kept the paths clean or clear for people who need care to get it. I didn't put case counts up here because they've changed from this morning to this afternoon. But here's the other thing that we've learned in the last 24 to 48 or 72 hours. We've learned that there are a lot of people sick. There were a lot of people sick much earlier than we were aware. We've now talked to a bunch of our clients who have told us that they had entire offices that were sick the second and third week in January with symptoms that are incredibly consistent with COVID-19. And just for those of you who are not familiar, although I think most of you are at this point, the symptoms are, in some people, fever, respiratory symptoms, shortness of breath, some with runny nose, some with a sore throat, some have a little bit of diarrhea on day 1 or day 2 or stomach upset. But when we look back, second and third week in January, there were entire offices that this passed through in the exact timeline that we can now identify. And I'll talk about that timeline for a second. Most people are getting sick on or around the 5th day after they were exposed. 20% of people have no symptoms, 20% of people develop no fever. Here's the most important part and why this is really all sort of good news. 85% of people in the United States will not need medical attention when they get COVID-19. And the CDC is asking them not to seek medical attention. So we now think that somewhere at the low end, 500,000 people, at the high end, 1 million or more people have already had COVID-19 in the United States, that our testing lagged, our identification of it lagged, our awareness of community spread lagged. And that's really, truly incredibly good news because we didn't swamp the medical system. We didn't see a spike in the death rate. So in fact, it's out there. That's sort of the bottom line. We're now dealing with lots of other issues that are impacting the industry related to it. So many schools and universities closed, some for the remainder of the year. That creates childcare issues. That means that those of you that had college students working for you may have gone home that you expected to work later in the year. But it's the childcare issue that we're hearing the most about from our restaurant clients. The other news that we have right now is that the healthcare system is stressed but not yet overwhelmed. That certainly may change and may change quickly as this continues to grow over the next several weeks. We're in an industry where it's really hard for us to self-quarantine. We need to go to work in order to make food, to deliver food, to provide takeout food. The other question that many of you have asked us is what is the actual restaurant scenario related to food service and food delivery look like with COVID-19, and I'll get to that in a minute. But that's sort of the snapshot of where we are with the COVID-19 risk today. It is extremely widespread. There was a statement in one of the New York papers yesterday that everyone in the public health community immediately felt was absolutely spot on, which is that likely everyone in New York has already been exposed to COVID-19. Some have had it, some had it and didn't know it, some had it very mildly, some are about to get it, but that much of New York has already been exposed. So what are the coronavirus issues that we're seeing in restaurants now? And this is what's changed so dramatically since I spoke to this group at the actual restaurant show in New York 9 days ago. Then I talked about a high level of fear. I talked about issues with people not wanting to serve foreign parties. We talked about cancellations of events. We talked about sort of issues about when it was coming, but now it's here. And what are the issues that we're seeing that it's here, and that certainly every large restaurant group in the country has been impacted, but many of you or all of you have been impacted in other ways now. So in the last 72 hours, and it really is 72 hours, we're seeing a widespread issue with ill employees that actually have COVID. Now, I'm going to talk about fake COVID in a few minutes, because that's been one of our biggest issues in the last couple of days. But what happens when you have an employee who either is tested and told they have COVID-19, thinks they have COVID-19, has the symptoms, or that a provider has told them that they're presumptive positive? And we have new guidance from the CDC on that just today. And that guidance is that the employee needs to be excluded for a minimum of 7 days, but 7 days plus they need to be symptom-free of fever and respiratory symptoms, or respiratory symptoms resolving for 3 days without them taking Tylenol. Let me go over that again, because it's a little complicated. And again, it changed today. What we're hearing is, or the latest guidance from both the New York City Department of Health, who's taking their guidance from the CDC, and from the CDC, is that ill employees need to be excluded for a minimum of 7 days. We were saying 14 days until yesterday. 7 days plus 3 days fever-free without Tylenol or Advil. So we're finding that most employees are going to need to still be out approximately 10 days, because the illness is lasting 5, 6, 7 days. Tack 3 days onto that, and you're at about 10 days. We have been asked not to ask for doctor's notes from anyone, because we don't want to clog up the healthcare system with people that don't need medical care. We don't want to necessarily expose people to this in settings when they may not actually have it. So that makes it complicated. And I'll talk about that again in a minute, but it makes it complicated, and there needs to be some level of trust or faith that someone is telling you the truth. Until today, we were excluding employees who had family members or intimate contacts who were ill or being tested. We were excluding them for 14 days based on guidance from all these regulatory agencies. It appears that since we've all now been exposed, the CDC is no longer recommending that we exclude every family member when an employee has been ill. There are some times that a family is being quarantined for a specific set of reasons, like in the containment zone in New Rochelle, like when there's a cluster, or there appears to be a super spreader, or there are a large number of people in the same family who are ill. But as of today, they're saying you don't need to keep an employee out because they have a family member or intimate contact is ill or being tested, because we've all been exposed. And this is a major shift in the last 12 to 24 hours. So I need to tell you a little bit about my day yesterday. My day yesterday was probably one of the most difficult days that we've had since this started. And it was difficult because of fake reports of illness. I need to tell you 2 quick stories. The first was in Colorado. In Colorado, we ask everyone who tells us that they have coronavirus, do you have a copy of a lab report? Can you ask your doctor? If the report was emailed to you, can you forward it to us? They don't have to, but it lets us get a better handle on what's going on, and to confirm certain cases and to confirm incidents. So asked an employee who reported that they were confirmed positive for COVID-19, do you have a lab result? And they said yes. And we're like, great, can you send it to us? And what we get is a 176-page PDF. The first page is, in fact, looks like a lab report on Colorado Department of Public Health stationery, employee's name, employee's identifiers, and a lab result that looks like COVID. The other 170 some odd page are an air quality index report for indoor air quality in a building in Colorado. So, it crosses our mind that, hey, they spooled up this testing so fast that somebody in the Colorado State lab went to get a template and took the wrong one, and this is what they took. But that seemed somewhat far-fetched. But it also seemed really far-fetched that someone would go to the extent in the middle of a pandemic to falsify a laboratory test that said that they had coronavirus. But that, in fact, is what they did. Because when we got the epidemiologist for the state of Colorado for this district on the phone and shared it with them, they told us that it was not what the reports looked like, and the reports looked like every other lab report that came out of their lab. So again, why someone in this day and time, other than that it was based in fear and that they didn't want to go to work because they were afraid to, or they had childcare issues, we don't know any of that, but we know that we got an actual fake lab result from an employee who told us that they had COVID-19. Then we had another scenario, and this is for our friends on this call who are in Florida. So yesterday afternoon, and restaurants were still serving in dining in Florida with sort of the usual procedures yesterday. During lunch, a server excused herself while waiting on a table and said, "This is my doctor calling. I'm sorry, I need to step away and take this call." Walked back into the alley where a number of her coworkers were standing because there wasn't that much business in the restaurant yesterday, and speaks on her phone for a moment, announces that she has coronavirus, she has to leave right now, and runs out of the restaurant in front of her coworkers and the guests, essentially crying. So one of our nurses here at Zero Hour Health and Zedic reaches out to her, and we get no response. A little while later, we reach out again, and we find we communicate really well with employees by text message. They sometimes don't answer the phone when it's a stranger calling, a strange number, but they will answer texts. And she replies, "Well, I'm in my doctor's office right now." And we're like, "Great. Can you please take your cell phone, take a cell phone picture of the lab result and send it back to us?" And she goes radio silent for about 10 minutes. Now, let me tell you what was going on in that 10 minutes in the restaurant. There was panic amongst the staff. It was very difficult for the guests not to know. They were making a decision as to whether they had to shut down that minute. The kids that were working in the restaurant were calling their moms. It went out on social media. It was really sort of 10 minutes of mayhem. Didn't need to be, but it was. 10 minutes after her radio silence, her next text is, "Uh-oh, it was a false alarm." And, that is what our entire day was like yesterday. So we did just get some data a few minutes ago that tells us that only 20% of the coronavirus lab tests are positive, 80% are negative. So some of those, in fact, are false alarms, or people are sick with other things. The testing criteria is an important thing for you to be aware of. They are not testing everyone who shows up at a doctor's office or shows up at one of these drive-through clinics or goes to an ER or an urgent care for coronavirus. They're testing only those that appear to need further medical attention. There's still a shortage of tests. We expect that'll smooth out soon. But the point that I want to make is that we do want to assume that someone who is sick has coronavirus and has the symptoms, has coronavirus, and they should be kept out of work. But that we also are having some difficulty confirming cases, and we're seeing a lot of behaviors amongst employees, staff out there who are concerned, who are aware that many of you are now paying sick time. And again, this all kind of changed when we went to takeout and delivery only in so many places, but that's what we've been dealing with even as recently as today. Now that takes me on to the varying and rapidly changing state and local executive orders. For those of you on the call who are in Florida, you know that at about 11:15 a.m. this morning, the situation changed dramatically in Florida. We did not have an executive order in Florida that was directing traffic and those kinds of issues for Florida. I want to talk about the other states first. We had states that included New York, parts of California, Michigan, Illinois, Ohio, that are allowing only takeout and delivery or curbside and delivery. But then the order came out in Florida at about 11:15 this morning. That was where New York started out before the weekend. So the Florida order, as far as we understand it, says, and we've really only had a very short time to read it, that you need to limit your occupancy to 50%. You need to do that by removing tables. New York might have not had to go to what they went to, which is delivery and takeout only, if they had written their limit occupancy to 50% in that way. Some of you may have seen pictures of New York Friday and Saturday night, or pictures of Reno or Vegas or Nashville, where there were very crowded restaurants and bars Friday night, and they weren't necessarily that crowded, but that people were not spread out, that they were, all lined up on the Hudson River, at those restaurants on Friday night and Saturday night, that they were nice evenings. So again, what the Florida order that came out to this morning, as far as we understand it, says is that you need to limit in-dining occupancy to 50% by removing half of your tables, and this is a big and, you need to do employee health screenings. There's a health screening tool on the CDC's website. We can find other ways to share them. If you email the organizers, we have a form that we can share with you as well. But you need to ask some basic employee health screening questions before employees start their shift in Florida. It is not a bad idea in other places as well. It does take some logistics to administer, but you need to ask them specifically, do you have respiratory symptoms, fever, cough, runny nose, any other symptoms that we need to know about? If you do, you need to leave. So again, Florida implemented this pre-shift employee health screening. There was very little guidance in the executive order, but that's the gist of it. We had some other really interesting challenges with all these executive orders. For example, in Montgomery County, Pennsylvania, the governor issued a statewide executive order which limited occupancy, or allowed curbside takeout or delivery. Montgomery County appears to have required restaurants to close. The King of Prussia Mall closed, which has a large number of restaurants associated with it. And the Department of Health went around to restaurants and told them they needed to close. And that differed from the governor's executive order. So this is really, that part of this is very, very, very challenging. It is changing by the hour. We've always told our clients it's a really good idea to have your health inspector's cell phone number, because that's a really good way to get information. Call your local health department, check with your restaurant association, check with what your neighbors. You never want to be the only restaurant either open or closed. But there isn't, we've been asked over and over again if there's a single repository for this information, and there really, unfortunately, isn't. You need to be, it's hyper local, it's changing. San Francisco is an example. The governor issued a statewide occupancy limitation yesterday, and then San Francisco and the other 6 counties in the Bay Area went to something as severe as a shelter in place. We have heard rumors of a shelter in place in New York. We have not heard anything besides rumors. And in shelter in place, what they left in San Francisco was only emergency personnel, grocery stores, pet stores, I believe they said, medical facilities, pharmacies were open, that restaurants could continue delivery and takeout. So one of the other issues that we heard a lot about last week and seems to be smoothing out a little bit are sourcing issues and supply shortages. A question that we got probably 200 times last week was, we can't find hand sanitizers, and here was our answer. It would be nice to have hand sanitizers, but we are fortunate to have soap and water, and soap and water is our best solution, our best defense, and in some instances, our only defense against Hep A, flu, norovirus, coronavirus, measles. So what we want to encourage is proper, good hand washing. If we have hand sanitizer available, great. If we don't sweat it. We know that many of you would like to see it out for your guests. We don't know where to source it right now, although we found, oddly, that some pet stores have it in stock. We had pretty good steady supply from the main chemical suppliers. Ecolab did have some back shipping or a couple of day delay on their multi-quat product. I have not heard it on their hydrogen peroxide product, which is one we love. We are huge fans of Purell foodservice cleaner, and we have not heard about there being any shortage on that, or that being out there through your distributors. A week ago Thursday, the EPA issued a list of coronavirus approved cleaners. Most household cleaners are on it, again, because coronavirus is pretty easy to kill compared to other things that we're sometimes trying to kill in a restaurant, whether it's Hep A or Salmonella or something else. But you can go to the EPA site or Google EPA approved coronavirus cleaners, and you'll find that list. There are many cleaning products in your grocery store, assuming they have them in stock, that are on that list. So I just want to talk a little bit about the move to curbside and delivered food. We're hearing a lot of questions, and a lot of them from foodie sites, Eater, Infatuation, you know who they all are, with questioning whether or not delivered food is safe, whether it's safe to eat restaurant food right now. And there's a number of reports out there that do talk about finding coronavirus in fecal samples of people who have been infected. I want to make one point that you can feel free to quote me. You'll find it on the CDC site. There has been no evidence of foodborne transmission of coronavirus anywhere in the world at this point in time. There has been no evidence of foodborne transmission in the United States. And we absolutely, without a doubt, the entire public health community both believes there's no reason that food from restaurants or elsewhere isn't safe. We have all continued to order takeout and delivery as we've worked these incredible hours and need to still eat. One of the last questions that we've gotten a lot in the last week to 10 days, this is starting to slow down as people are coming home, are employees returning from travel and how long to keep them out of work. Right now, there are some really clear guidelines. Employees returning from China, South Korea, Italy, Iran, most of Europe now, including England, need to stay out of work for 14 days before they can come back to work. Obviously, that's up to you, but the 4 that are absolutely really hard and fast, that these people are being told to self-quarantine as they come through airports, self-quarantine for 14 days. China, Europe, Iran, South Korea. We're getting a lot of questions. I had absolutely no clue that so many people were still on cruise ships last week, but there's a lot of people coming off of cruise ships right about now, and as the cruise industry literally completely winds down. I would probably not allow someone to return to work in 0 Hour Health or at Zedic if, in fact, they were coming off a cruise ship. I would probably ask them to stay out at least 7 days, but possibly 14. So that's the issues that we're seeing right now. What can you be doing? This is really straightforward. This is what you should be doing every day to prevent Hep A, norovirus, coronavirus, and I do need to change one thing on here. Hand washing prevents colds, flu, Hep A, norovirus, and coronavirus. Cover your mouth when coughing. Don't work sick. Don't let anyone work sick. Don't come to work unless fever-free for 72 hours and the respiratory symptoms are resolving. If someone has had vomiting and diarrhea, they need to be symptom-free for 48 hours before returning to work. In the last 48 hours, we've had 2 clients that have had cases of Hep A, and we've had 2 clients that have had norovirus outbreaks. So it is still norovirus season. Norovirus season really doesn't end anymore, but both of those things are circulating right now, and we want to be really certain that we keep our eye on the entire employee health ball, foodborne illness, coronavirus, everything. So again, from the top, how do you keep your restaurants and teams safe? Hand washing, hand washing, hand washing. Don't work sick. Don't let anyone work sick. You need to lead by example. Anyone who's had coronavirus symptoms, but particularly a fever, respiratory symptoms, dry cough, those symptoms that are associated with coronavirus need to stay out of work for a minimum of 7 days, but 7 days and be fever-free for 72 hours without Tylenol. And that's a really key part. Again, we've got norovirus still circulating. If they've had vomiting or diarrhea, they have to be symptom-free of those symptoms for at least 48 hours. Bathroom cleanliness is more important than ever. Focusing on the touch points, toilet stalls, sink, and bathroom door handles, your hand washing sinks at work and at home. And again, hand washing, hand washing, hand washing. You will never hear me talk without me harping on hand washing. So one of the other questions that we've been asked a lot in the last few days, and I'll go to your questions in just a minute, but one of the questions that we've been asked a lot is, what can you be doing to make curbside and delivery safer and easier? One thing is, if you don't already do this, we suggest you implement a simple daily wellness checklist. How are you feeling? Do you have a cough, shortness of breath, fever, or other symptoms? Let us know if you need a sample. Again, this is required in Florida, effective at some point later today or tomorrow. I didn't get to that line of the executive order before it was time to go live on this. We do suggest, and this is new because some of you are new to delivery or this volume of delivery or curbside or takeout. You need to have a system for keeping an eye on the food that's awaiting pickup. Guests can be delayed. Drivers may be overwhelmed with delivery. We want to be sure that food isn't sitting there for too long. So there may be times that you need to toss an order, that you need to refire an order, that you need to make sure that an order that's sitting there doesn't get just eaten by other people because it's been sitting there for so long, because it's been sitting there for too long. And again, this is new to many of you. We'll try to put out some more information and some more detailed information on this as the days go by. We do want to suggest that you use tamper-proof packaging. Not that we believe that it's absolutely necessary, but it's what your customers want to see. We're hearing that over and over again. For those of you who are at this show or at other shows, you'll see that we're hearing from you that that's what they want to see, because there was pretty good traffic even in a down attended show at those booths that were selling packaging and tamper-proof packaging. We do suggest your curbside runners are gloved. We don't think that there's necessarily a clinical reason for someone handling a closed, sealed bag of food to be gloved. But again, it makes your customers more comfortable. It's not a bad idea. And presumably, we have lots of gloves these days. And then one thing that someone threw up there last night, which I absolutely think is a good point. It gets dark relatively early yet this time of the year here. Consider adding more outside signage and lighting for pickup if you have more people coming, particularly for dinner pickup. And then last but not least, don't forget that we still have risks of noro and hep A to be alert and to remind your team. We are watching for those symptoms as well. We don't want to be so focused on coronavirus that we miss those other signs of foodborne illness. Oh, they don't have a dry cough or respiratory symptoms or a fever. They're fine. They're good to work. Well, they might have yellow eyes, they might have darkened urine, they might have been vomiting for the last 24 hours, but since it's not a symptom of coronavirus, let them work because we need them to work. That is bound to get us all into trouble. We're going to take questions in a minute. I did want to tell you how to get more information. You can visit Zedic at getzedic.com. 0 Hour Health is for the large organizations, zerohourhealth.com, but again, Get Zedic is our new product, very targeted for the market. And for those of you who missed the show, there's a discount code at checkout, which is SHOW, S-H-O-W, which will give you the show rates, which was a very significant discount off of the app. There's you can buy a single seat or one for as many of your managers as you might want to. And now I'll turn it back over to Patricia to take some questions.
Thanks so much, Roslyn. I really, really appreciate all of the information, as I know everyone else does on this call. Really quickly, before we go to questions, I just want to remind everyone that this is being recorded, and we will be sending this out via email. If you had signed up, you'll get a copy of this. We will also be posting this on our website, www.foodandbev.com, where you can listen in on the recording there as well. So Roslyn, we do have quite a few questions already that have come through. I will start with the first one here. Should COVID-19 get transmitted to food via saliva, does reheating to 165 for 15 seconds destroy it?
Well, that is a really good question. And one of the things that I didn't say earlier in this conversation that I did mean to say, and I've said elsewhere, is there's a lot more we don't know about coronavirus than we do know. And that is one of the things that we don't know. So we don't know, we do not believe at this point in time that there's food transmission possible. However, we don't know whether or not there's any reason to believe that reheating would help it.
Okay, thank you. The next question we had here is around technology, and I feel like this question may have gotten, it's not written correctly, so I'm going to try to understand here. There are tools out there for hand washing to show if employees are washing correctly. So do you recommend any of this new technology?
Good question. And the answer to that is, I think that we have technology being developed that's excellent. I don't think that you have I think that that's a longer conversation than we have time to have during this coronavirus crisis. So am I a fan of us implementing some of the newer technologies that make sure that employees are properly washing their hands? Yes. Do I think that they're a solution for today? No. There was some time ago that there was a norovirus outbreak in Connecticut, and I am not one who generally teaches hand washing, but for some reason, the health department decided, because I was the one communicating with them, that I needed to come to hand washing training for the staff of this restaurant before they could reopen. And I drove up to Connecticut in a snowstorm on a Saturday, after a snowstorm on a Saturday morning, and met with 50 employees, with the health department, watching me do hand washing training. And they wanted an hour's hand washing training. And an hour's hand washing training is really hard. It's hard to talk about hand washing for an hour. But we watched a video and we did buddy hand washing and we sang happy birthday twice, multiple times to everybody who was in the team. And then we lined up and we used a black light and the glow germ powder that some of you may have seen and did essentially a hand washing test. And of the 50 employees who had just watched an hour's worth of hand washing training, only 7 had actually properly washed their hands to get the glow germ powder off. So good hand washing is hard. I want to put that in perspective when it comes to coronavirus. Coronavirus is particularly easy to wash off if you wash your hands for 20 seconds or longer. So yes, I'm a fan of technology. I'm not sure we have time now to buy and install technology. We need this good hand washing literally today.
Thank you. How long does the coronavirus live on surfaces, and is clothing considered a surface?
Okay, another good question, and another question where we have some really mixed information. We have information from as short as 3 hours to as long as 9 days. We do not have specific guidance with regard to clothing. We have some information about soft surfaces, the surfaces that we together are concerned about: chairs, booths, curtains, the soft surfaces that we have in restaurants. We understand that, again, the virus wipes off very, very easily from most surfaces. And again, we've heard anywhere that it lives from as short as 3 hours to as long as 9 days. But what we know about coronavirus, and we know this incredibly well at this point, is that the primary transmission is person to person. So I want you to have clean restaurants. I want you to sanitize if you know that you had a case. Keeping everything spotlessly cleaned and sanitized now is going to help us prevent the spread of transmission of everything. But this is primarily an illness that has person-to-person transmission. So not exactly the answer to the question, but you have the gist of we're not really sure.
Yes, and this actually goes right into the next question, which is, if since we've all essentially been exposed or all have been exposed, can we be reinfected?
We don't know the answer to that. We believe the answer is no. We know you can't be reinfected right away. There are a couple of reports out of China, and not a lot of documentation to back them up, that there are some people that may have gotten sick a second time, but it's a relatively small number. Our goal here is to get through this wave, to buy more time, to increase the capacity of the medical system, to work on a vaccine, to identify treatments that are more effective, because right now there really isn't any specific treatment for coronavirus, and that'll get us through to the end of this, of this wave or this cycle of the illness. But the answer is we're not sure. There are some reports of reinfection. They haven't been validated. It doesn't appear to be a major issue at this time.
Thank you. The next question is around the weather and getting warmer. Is the coronavirus expected to subside when we see warmer weather?
Well, that's a favorite topic amongst my public health geek friends and I. And there are two schools of thought. There's one that, just like flu, that we would see it wane when the weather got warmer, and there are others that say that that data or that behavior of a virus doesn't hold true for a novel virus, and meaning a new virus, and that this is a novel coronavirus and none of the data supports that it would wane in the warmer weather. We have not seen it wane in Australia where it's warmer. So the answer is we don't know. The public health community is pretty well 50-50 divided on both sides of that argument, and only time is going to tell. For us, what we expect is that we're going to see this cycle of the epi curve peak and then go down. It happens to coincide with warmer weather, and we won't know if it was the chicken or the egg.
Gotcha. That's a great explanation. Thank you. The next question, can testing reveal if someone is a carrier of the coronavirus?
Well, testing will indicate whether or not you have you have or had the coronavirus. But this is a good question, and I want to give a couple different answers to this question. So we know that 20% of people who have coronavirus have no symptoms, and that's really troubling. And because they can infect other people even though they have no symptoms. Right now we have a tremendous shortage of testing supplies in the US and a tremendous shortage of capacity to administer those tests. So we are only testing people who are symptomatic. And that's a question that comes up over and over again. You know, my wife has coronavirus, my employee's wife has coronavirus. Can I send my employee to go be tested? I want to know that I don't have coronavirus. Can I go be tested to know that it's safe for me to be around other people, to be in my restaurant? And at this point in time today, we are not testing people in the United States who are asymptomatic. If they don't have symptoms, they're not being tested. So again, not necessarily a direct answer to the question, but yes, if someone was exposed to and had coronavirus or is incubating coronavirus, it would show up in that test. But again, we're not testing people who don't have symptoms.
Thank you. The next question is out of Florida. Where is screening for Florida restaurants?
I'm sorry, could you repeat the question?
The question is, where is screening for Florida restaurants?
Where the screening, you have to do it yourselves. You have to a very simple screening form or screening tool so that everyone who comes to work completes a short questionnaire or answers a very short survey before they start working. They need to be asked if they have had any symptoms in the last several days. Again, there was no guidance with the executive order. So at this point, we are somewhat winging it till we have more guidance, but we know what a good symptom survey looks like. And it asks an employee, you know, have you had any of the following symptoms, you know, in the last 7 days? If yes, you need to leave. If no, you can go to work.
Okay, and actually leading into this next question, I think you sort of answered that. I just saw the presidential press conference, and they said to assume that if one family member has it, you should assume that the whole family has it. Can you let an employee work if a family member tested positive?
Well, that's a confusing question, and I'll tell you why. We got really different guidance from the CDC and departments of health this morning. The guidance that we had was that we no longer needed to exclude employees if family members were sick, if they weren't sick. So I did not hear the president speak because I was either on this call or preparing for this call, but I will say that I really can't answer that question right now because again, the guidance we had from the CDC today was you can go ahead and let people work if they don't have symptoms, if they haven't gotten sick. So we'll certainly need to get some clarification on that, and I apologize for not it being so gray.
The next question, what resources are there for food service workers who are out of work due to the coronavirus other than unemployment?
That's out of my bailiwick. I'm a public health professional. I think that the New York Restaurant Association, the Florida Restaurant and Lodging Association will have a lot of resources for you. The National Restaurant Association will. I'm in Connecticut, and the Connecticut Business and Industry Association put out a guide yesterday. I'm sure it already needs to be updated today, but unfortunately, my area of expertise is public health and not the financial part of it.
Yes, thank you. And just to let whomever asked that question, I'm not sure where they reside, but I do know that the New York Restaurant Association had discussed some things surrounding that. So I'm sure if you look at your state's restaurant association, you'll probably find some more resources there. The next question we have here is, what if someone is running a vending route where they are selling prepackaged chips and drinks? Should the employee still wear gloves?
Well, I think that that's very much guided by the jurisdiction in which they're in. I think that the public is looking for people to wear gloves now. We had a lot of questions last week about handling money and handling food, or handling money with gloves and then using those gloves to serve food, which is not good food handling practice. I can't answer for every jurisdiction that's on the call. I can't tell you that there's an absolute clinical reason to be wearing gloves in those circumstances. If you're on a food truck where you have limited hand washing capabilities, that may be more appropriate to change gloves much more frequently and to wear gloves in those circumstances. But I think you have to check it jurisdiction by jurisdiction. We have 4,000 health departments in this country.
Thank you. Um, Assuming COVID-19 has been around for months, what do you expect the curve to do in the next 2 weeks to 1 month?
Oh, I'd probably be really rich if I knew the answer to that question. I've heard reports this morning. First of all, I would encourage everyone to follow the guidance of staying home for the next 15 days if you're able to, that only those who have to go to work in an office or a restaurant or a medical setting or a grocery store or a pharmacy should do that, that if we practice good social distancing for 15 or more days, and if we had started this a month or 2 months ago, we wouldn't be in the situation that we're in now. We expect that this will be effective if we do this well for the next 15 days. I can't say we're doing it that well yet in the places where it's not been mandated, but that if we do this well, we'll start to see that the curve flatten. I think many of you have read some of those flatten the curve articles, and you can see them at the blog on getzedic.com. There's a really excellent flatten the curve article. But I think that we will see this start to peak in the next couple weeks and taper down through April and into May. I think we will see active cases for a year, but I think that we will start to see control in the next month. At least I may be wishful thinking here.
No, I'm listening to you and hoping for the same. So the next question here, does everyone or should people be wearing a mask at a restaurant?
No. Really definitive answer. The only people that should be wearing masks are people who are actively sick. In the healthcare profession, we put masks on the patient. You put the mask on the patient first, just like you put the mask on yourself first on an airplane. Anyway, you put a mask on the patient. That was a question that we got a lot last week and the week before, and we're starting to get lesser now. Here's the bottom line: masks don't really do much, but what they do is protect droplets when someone who is sick is coughing or breathing. So the answer to the question is no, we do not believe that anyone needs to be working in a restaurant wearing a mask or should be. We know that guests do not want to see employees wearing masks. We know that employees don't want to see guests wearing masks. So we did a pretty broad survey amongst our larger clients in the last week, and the answer was they were uniformly not allowing employees to wear masks. If employees were so uncomfortable that they felt that they couldn't come to work without wearing a mask, then they couldn't work, was the decision they made, and I respect that decision. We also need to stay masks. I'm sorry, just one other point. There is a tremendous shortage of masks, particularly of N95 respirators, but also of surgical masks. And we really need to leave them for the people that need them, that are in the healthcare profession, that are protecting all of us.
That's a great point. Another question in regards to business for restaurants. What are some tips that you can offer for bringing business during these times? For example, gift cards, discounts.
Well, I belong to a working moms group online, and last night someone published on it a list of all of our favorite local restaurants and suggested going to buy gift cards. Certainly us all, encouraging takeout and delivery amongst our friends and our social circles. I think that there are some restaurants that are doing some really creative things. One of the restaurant groups in New York did a nightly family dinner. So you could buy a dinner for 4 at a reasonable price from a relatively high-end restaurant. The other thing that we saw that was really great idea was doing one dinner a night and totally blasting it across social media and their email list and their friend community, so that they were doing one dinner or 2 dinners really well. It's easier to cook 2 dinners than 15 different menu items. They picked things that whole families would like, or that there was sort of something for everyone by 2 of a pasta that was vegetarian and an animal protein based dinner, and we understand they did pretty well with those. So just having a reasonably priced, here's our specials of the night. What time do you want yours?
Thank you. Those are all great ideas. And I'd like mine now. No, I'm just kidding. The next question, The next question we have here is, should we refuse people who want to use the washroom?
That's a really difficult question. Again, you have to go back to what your local jurisdiction says. There are a lot of jurisdictions now that are saying that you can't do takeout, that you can only do curbside and bring the food to them outside of the restaurant. So again, you need to know your local jurisdiction. And I'm not sure that, again, we haven't necessarily seen transmission of this in that way. I'm not sure that I'm really qualified to answer that question.
Thank you. Do you think restaurants should be using disposable plates and silverware for dine-in customers?
Well, I would say that half of our, or more than half of the restaurant community at this point doesn't have dine-in customers. And I would not be surprised if we see no dine-in customers in the foreseeable future. And was surprised, we really all fully expected to hear that when the vice president spoke yesterday, and was surprised when we didn't. You know, and for the Florida restaurant community in particular, where, you know, I know it was a real win for the Florida restaurant community with what the governor said this morning, although we are seeing really, really reduced traffic, even though there are the occupancy limits. No, I think that we have good dishwashers. Again, we're not seeing foodborne transmission. Follow really good food handling practices. Make sure your dishwasher has been serviced. You know, call for service if it hasn't been. Make sure that your 3-compartment sinks are proper, have the proper chemicals, and that you're using test strips. But no, I don't see a reason to go to paper at this point.
Roslyn, what happens if a customer says they visited your restaurant and they have the virus?
It is the first time that I've been asked that question in all these webinars. And it's a good question. You know, I think that this morning or this afternoon, it is very clear that we have an extremely broad community outbreak of coronavirus, and it would be impossible to tie their coronavirus to your restaurant. With that said, as you know, we have litigious guests, and I think that I would refer them. My response is I would refer them to the local health department.
Thank you. The next question is around the test for COVID-19. Is the only test available through the nose, which is supposedly very painful?
Well, let me clarify that. It's not that painful. You don't want to do it to yourself, but it's not that painful. But that is correct. There is an oral swab and a nasal swab. They need to be done by a healthcare professional. It's not that painful. And it is correct. That is the only test currently.
Thank you. Should we be concerned about the food supply, and will there be enough food in the stores?
Well, again, that's a bit out of my bailiwick, but I do trust that we have enough food in the stores. Our local stores here in the New York area are getting deliveries every day. You know, over the weekend there was quite a bit of panicked buying, but there is food coming in. There's a tremendous amount of food in the distribution system, and food continuing to come in. Again, outside of my bailiwick, but everything that I've read shows that that's not necessarily a concern.
Okay, thank you. And actually, these next few questions kind of are similar to that and lead into it. When groceries are purchased, packaged food, should they be wiping down with disinfected, all of the containers? And also, is it possible for the virus to be transferred by money, which I do believe you touched upon prior, but.
Sure. I did not wipe down the cans that I brought into my house, and I did do some shopping starting about 2 weeks ago to prepare for this, and then again in the last few days. I did not wipe down the cans. I am a huge fan, as I said, of hand washing. So when you're handling cans, when you're handling anything that you're throughout your food preparation process, you should be washing your hands multiple times, and that would address that issue. And I'm sorry, what was the second question?
About money, if the virus is.
We had a lot of discussion about that last week. There hasn't been any proven transmission of this through money, through touching surfaces. It is primarily a person-to-person transmitted illness. It is airborne. The drops aerosolize, and that's how you get it. We are aware, and I am more comfortable in places that are letting me do touchless payment systems. And pizza we ordered at my house last night, I paid over the phone. But that was more that I just didn't, I wanted to make my time in and out of the pizza place where I went to pick it up faster. But we don't have evidence that there's transmission through money or any other surface. Again, focused on person-to-person transmission.
Great, thank you. I just wanted to say I'm going to read you our last two questions. The first one being, do we have an update on delivery platform about waiving fees?
I don't have an update on that. I heard many of them have moderated their fees or modulated their fees. Again, I think your local restaurant associations, your state restaurant associations are your best bet for information on that, or in fact, the platform themselves.
Okay, thank you. And our last question here, where exactly can we find the pre-shift health screening info on the CDC website?
I don't know the answer to that because it came out so quickly before this. If you could take that person's contact information off the question, I will make sure that we answer or that we put it out in some other way.
Great, thank you. And also, I see you have your page up with your telephone number. Is there an email address or anything that you wanted to share in case anyone has any questions?
If you want information on Zedic, it's getzedic.com. We strongly suggest, again, it's a new service for small restaurants and a way to stay up to date on all of this and whatever the next thing is that comes down the road after coronavirus, because we certainly are going to be, certainly leaner, meaner, and need to be more careful with everything after this. If you, as I said, if you want more information, you can go that way or go info at either of those.
Okay, wonderful. And I just also want to remind everyone again, you will get a copy of this recording and it will also be posted up on our website. And Roslyn, I just wanted to say a big, huge thank you from us at the Clarion event, and also a similar shout out from East Palo Alto, California, just thanking you for all of this information on the webinar, which allows everyone to better serve their community and employees. It's greatly appreciated.
You're welcome. Thank you all very much. Stay safe, wash your hands, and don't go to work sick.
Thank you. Have a great day.